Hello again everyone, and welcome back to the channel. In today's video we're going to be talking about the 2023 changes to Medicare and what that means for you. Before we jump into the video, please make sure to subscribe to the channel and turn on your bell notifications so that you're always notified whenever I'm posting new content. Please make sure to watch the video in its entirety so that you can hear anything that might be applicable to you. If you enjoyed the video or you got something out of it, please make sure to give it a like because it does help out the channel tremendously. And if you had any questions about anything that I've covered in the video, please leave a comment down below and I will reply as soon as possible. Alrighty, so I'm at cms.gov. If you didn't know, CMS stands for the Center for Medicare Services. And this is their fact sheet going into 2023. So the 2023 Medicare Parts A and B premiums and deductibles, 2023 Medicare Part D income-related monthly adjusted amount. This was posted last September, which for those that don't know, September is the end of the fiscal year for the government, and October 1st is the beginning of the new year for them. Right, so hopping right into it, Medicare Part B premium and deductibles, or basically, let me back up here. This video, or I should say this article, on September 27th, 2022, the Center for Medicare and Medicaid Services released the 2023 premiums, deductibles, and coinsurance amounts for Medicare Part A and Part B programs, and the 2023 Medicare Part D income-related monthly adjusted amounts. If you don't know what the income-related monthly adjusted amount is, or IRMA, check out my other video if you're affected by it. But basically, that's when your income passes a certain threshold. You will be charged more for your Medicare Part B, as in boy, and D as in dog. And the Part D premium or surcharge would be if you had Part D or not. So even if you didn't have a third-party Medicare plan for Part D, you would still pay a surcharge on that. Alrighty. So Medicare Part B premium and deductible. Medicare Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and certain other medical and health services not covered by Medicare Part A. For more details for what Medicare Part A and Part B, the basic plan covers, you can go to medicare.gov. And if you scroll all the way down to the bottom, there's going to be a link for something called the Medicare and You Handbook. I do believe the 2023 version is available. And we'll actually jump over here real quick so I can show you. Medicare.gov, right? So if you scroll all the way down to the bottom, where is it at? Find publications, I believe it's going to be here. And there it is right there. Featured publication, Medicare and You 2023. I did a video a couple weeks ago. They didn't have this up yet. So if you download it, and here's the book. This is a great downloadable document to have, just because if you look down on your keyboard, the left control button in the bottom left-hand corner of your keyboard, if you press that and F, you can pull up the word search tab, and then you could put like eyeglasses. Right? Oh, that didn't come up. That was a fail. I care as here. Comes up as eye care. That's one of one. How about hearing aids? Probably a big one. All right. So then it will pull up everywhere that it mentions hearing aids, and it will take you right to it. All right. So super useful. Highly recommend saving this to your favorites or downloading it and keeping it on your computer if you need it. This does get updated every year, obviously, because Medicare is essentially an insurance company and is the easiest way to think of it. And, you know, all this information, like what we're doing right now, changes every year. Okay, so hopping back to the article here, Medicare Part B premium and deductible. Medicare Part B covered, we already read that. Each year, the Medicare Part B premium, deductible, and coinsurance rates are determined according to the Social Security Act. The standard monthly premium for Medicare Part B enrollees will be $164.90 for 2023, a decrease of $5.20 from $170.10 in 2022. The The annual deductible for Medicare Part B beneficiaries is $226 in 2023, a decrease of $7 from the annual deductible of $233 in 2022. So kind of wild to think that the Medicare premiums decreased. As far as my tenure at Social Security, that's never happened before. And I couldn't recall, even historically, when the last time that might have happened. So big win for the American people there. The 2022 premium included a contingency margin to cover the projected Part B spending for a new drug. I'm not even going to pretend to pronounce that. Lower than projected spending of both the drug and other Part B items and services related in much larger reserves in the Part B account of the Supplementary Medical Insurance, SMI. SMI is just another name for Medicare Part B. Trust fund, which can be used to limit future Part B premium increases. The decrease in 2023 Part B premium aligns with the CMS recommendation in a May 2022 report that excess SMI reserves be passed along to people with Medicare Part B coverage. So it sounded like what that sounds like to me, and I could be wrong on that, is basically with all the premiums they collected from Part B, there was a surplus, and instead of using that money for something else, they decided to go ahead and give it back to the people here. And that's what they plan on continuing to do. So hopefully that remains a trend moving forward. Beginning in 2023, certain Medicare enrollees who are 36 months post-kidney transplant and therefore no longer eligible for full Medicare coverage can elect to continue Part B coverage of immunosuppressive drugs by paying a premium. For 2023, the immunosuppressive drug premium is $97.10. So basically what this semi-paragraph is referring to here is if you have Medicare for end-stage renal disease, or other known as ESRD. So that's when you are basically going into kidney failure, or maybe you've had a kidney transplant. That's usually how you get that, really that's the only way that you can get that type of Medicare. So again, if you didn't know or weren't aware, there's age-based Medicare, which is at 65. There's disability-based Medicare, which is after 24 months of being on Social Security disability insurance, which is SSDI. And then you also have Medicare for end-stage renal disease, and I believe there's a version of Medicare for ALS. But I personally have never, I don't have any expertise in knowing kind of how people enroll into that or what was needed. And any of the offices that I've ever worked at, I didn't get the opportunity to see how somebody would enroll and review the policy to see what the criteria would need to be for ALS Medicare. But it does exist, I believe. Alrighty. Medicare open enrollment and Medicare savings programs. Medicare open enrollment for 2023 will begin October 15th of 2022 and ends on December 7th of 2022. During this time, people eligible for Medicare can compare 2023 coverage options between original Medicare, which is just A and B, and Medicare Advantage and Part D prescription drug plans. In addition to the soon-to-be released premiums and cost-sharing information for 2023 Medicare Advantage and Part D plans, a fee-for-service Medicare premium and cost-sharing information released today will enable people with Medicare to understand their Medicare coverage options for the year ahead. Medicare health and drug plan costs and covered benefits can change from year to year, so people with Medicare should look at their coverage choices annually and decide on the options that best meets their health needs. So this is kind of what I was referring to about the Medicare new handbook. Although it seems like even when I made my video a couple weeks ago, I noticed it was still only 2022. I felt like it was delayed for anybody that's trying to do what this is talking about, which is basically comparing your plans to see if maybe you need more than just regular Medicare A and B, if you need something else. So, maybe, something happened and you just got diagnosed with diabetes or some other condition that might require additional health coverage. So you can maintain your out-of-pocket costs and things like that. So During that season, that open enrollment, that's where you want to start to do that. So realistically, the last quarter of the year, if you have certain conditions come up or you're starting to get worried, maybe you're getting a little bit older and maybe you have hereditary problems that start to come into play and things like that. That's where you're going to shop around for like a health insurance agent to help guide you through that process. Those are going to be, if you have no idea where to start, that's what I would recommend, is just Googling, Medicare health insurance agent, and then, look through the reviews, make sure you find somebody that, works with you and can help identify your issues and maybe the type of plan that you need moving forward. To help with their Medicare costs, low-income seniors and adults with disabilities may qualify to receive financial assistance from the Medicare Savings Programs, MSPs. The MSPs help millions of Americans access high-quality health care at a reduced cost, yet only about half of the eligible people are enrolled. The MSPs help pay Medicare premiums and may also pay Medicare deductibles, coinsurance, and co-payments. For those who meet the conditions, and co-payments for those who meet the conditions of eligibility. Enrolling in an MSP offers relief from these Medicare costs, allowing people to spend that money on other vital needs, including food, housing, transportation, etc. People with Medicare interested in learning more can visit www.medicare.gov/yourmedicarecosts and go from there. So there is a program through the state, and I've worked in multiple states for Social Security, and I believe that this is kind of like a federally funded program, so it should be available in all 50 states. And it's called the Medicare, it's QMB, Medicare Qualified Buy-In. So that's basically where if you're in a low income situation, and it's likely that you're eligible for Medicaid, then normally what ends up happening is you get a subsidy where the state basically pays for your Medicare premium for you. So if you're in a position where it's very difficult for you to afford the $164.90 or whatever the monthly premium might be to Medicare Part B, you can apply for that state subsidy. Obviously, they're going to have a bunch of criteria that need to be met. They'll probably want to look at, they'll probably want a benefit letter from Social Security showing what you get every month, and then they'll probably want to see some bank statements and things like that to make sure that you're below whatever threshold is needed. And you can see, or at least read in this article here, that it's saying that only about half of the people who might be eligible for the programs are actually utilizing them. So if you think that might be you, I would contact your state's Medicaid office and ask them about the QMB program to see if you qualify for the Part B buy-in, where the state pays for your Medicare Part B. That way you don't have to come out of pocket. All right. Going further, Medicare Part B income-related monthly adjustment amounts, other known as IRMA. So this is basically when you have a surcharge to your Medicare Part B as in boy and D as in dog, whether you have that Part D plan or not, based off of your income. So if you're going to be affected by this, let's assume that you're already on Medicare. Typically, the letter will go out the third or fourth week of every November for the upcoming year. So if you're going to be affected by it, the letter will say in January, basically, it's going to say in January, we plan on charging you this much more because of the information we got from the IRS based off of your 2 years previous tax return. So as an example, 2020, if you're affected by this, your 2023 Medicare premiums are going to be based off of your 2021 tax return. 2024 will be based off of 2022, and so on and so forth. It gets evaluated every single year, so there's no kind of escaping it. And again, if you haven't seen it already, I did post a video about how to complete Form SSA 44 if you're affected by that surcharge. And that form basically, it forces Social Security to review your information to see if you qualify for either having your surcharge reduced or removed completely, depending on your situation. So go check out that video, and if that sounds like you. All right, I won't get into the chart here because it's a lot, but just know as a single person, if your modified adjusted gross income is greater than $97,000, then you're going to pay a surcharge. And there are, as you can see, a few different, there's 1, 2, 3, 4, 5 different tiers to the Medicare IRMA surcharge. All right, and then it's if you file as an individual, if you filed as a married couple and jointly, or if you file as a married couple and separate. This would be like if you're going through a marriage separation or you just do your taxes separately. There's different ways to calculate it, and the IRS will transpose that information to Social Security however you filed your tax return. So they have all that, and in the letter you get, it specifically says for this tax year, this is what you filed, this is how you filed, and what the numbers were. If they didn't, let's say you're in a situation where you're coming up into, for the current situation, I guess you could say, 2023, if let's say you did not file taxes in 2021, then they're going to go back to 2020, unless you tell them otherwise. So if you had an amended return, you filed an extension, something like that, and as a result you got that letter, again, you might want to have it evaluated. If you need additional help and you're not sure if you might be eligible for a refund or something like that, contact Social Benefit Advisors and we will help you kind of get all of that squared away for maybe a past year or the current year. We'll do whatever we can to help you out. All right. And this is going into the 2023 total premiums for high income beneficiaries. So it's really the same chart, I believe. Actually, no, it's slightly less for the immunosuppressive drug. It looks like the thresholds are probably the same though. 97, 123. Yeah, the thresholds are the same, but what you will pay is going to be different. Yeah, you can see here total monthly premium $230, total monthly premium is $161 because it's a different type of Medicare coverage, so it's a slightly different plan, I guess. All right, and then full Part B coverage, beneficiaries who are married and live with their spouses at the time, but who file separate taxes. So this is that other kind of bracket. If you get your letter, it will have a better version of this bracket here, where it kind of covers everything a little bit. It's easier to read, basically. It's a better template. All right, and this is Medicare Part A premium and deductibles. Medicare Part A covers inpatient hospital, skilled nursing facility, hospice, inpatient rehab, and some other healthcare services. About 99% of Medicare beneficiaries do not have a Part A premium since they have at least 40 quarters of coverage for covered employment. So 40 quarters of coverage, going back into fully insured status is what they call it. If you have 10 years of work history in the U.S., then you don't have to pay for Medicare Part A, as long as you're hitting a certain dollar amount each year and you're earning all 4 quarters of coverage. I believe you need somewhere around $6,500 to get your four quarters for the year in 2023, as an example. You can watch my previous video on insured statuses and things like that to help understand that a little bit more if you need that information. Or you could leave a comment down below and I'll shoot a link into fully insured status and kind of what that means if you need that. All right, Medicare Part A inpatient hospital deductible that beneficiaries pay if admitted to the hospital will be $1,600. So it sounds like if you go to the hospital and it's a visit that they're going to cover, your deductible is $1,600 in 2023, an increase of $44 from $1,556 in 2022. The Part A inpatient hospital deductible covers beneficiaries' share of costs for the first 60 days of Medicare-covered inpatient hospital care in a benefit period. In 2023, beneficiaries must pay a coinsurance amount of $400 per day for the 61st through the 90th day of hospitalization, which it looks like it's $11 higher than 2022, and a benefit period and $800 per day for the lifetime reserve days, which is $22 higher than 2022. For beneficiaries in skilled nursing facilities, the daily coinsurance for the 21 days through 100 of extended care services and a benefit period will be $200. So this right here is a good example of breaking down your plan. And so I believe this is just referring to standard Medicare Part A. and where your benefit might lie, and what we talked about here just a minute ago, in getting a health insurance agent for this open enrollment period from October to December. Now this was for 2022. I would imagine it's usually the same every year. It's that sometime in the fourth quarter of the year is when that starts to ramp up. So if you missed that window this year, I would, again, probably just review your family health history and any current conditions you might have, or things that might be starting to pop up, and evaluate if you think that you need additional coverage, and then wait for the, find out when the next open enrollment is and go from there, or see if maybe there's a way that you can wiggle in and get, see if there was some sort of extension rule or something like that, to see if you can still apply. I have not heard of one, but again, reach out to a Medicare health insurance agent and see if there's, some way to get signed up if maybe you waited too long and you're looking for something now. All right. Enrollees age 65 and over who have fewer than 40 quarters of coverage, and certain persons with disabilities may pay a monthly premium. So this is, again, if you're not fully insured, this is basically saying if you don't have those 40 quarters of coverage, you're going to pay for Part A. There's two types of premium-based Medicare Part A's. There's partial premium, and then there's a full premium. And let's see if it elaborates here. And individuals who have at least 30 quarters of coverage or married to somebody with at least 30 quarters of coverage may buy into Medicare Part A at a reduced monthly rate, which would be $278 in 2023. So that's the partial premium. And then the full premium is $506 if you have less than those 30 quarters of coverage. That would be, again, the full premium. This is jumping back over to the IRMA chart. Again, even if you just want to see the better chart, if you Google SSA 44, you'll see it on there. It's laid out tremendously better. I don't know why they broke this up. They could have made it so much bigger. But this is going over what you would pay for the Part D aspect of it if you cross that threshold of income from 2 years ago and you're on Medicare now. This is what you would pay. So again, if you had $500,000 or $750,000, I'm sorry, hang on. Beneficiaries who file individual tax returns modified adjusted gross income greater to or equal than $500,000, you're going to pay an additional $76.40. If you're a married couple with a joint return and it's greater than $750,000, then that's what your premium is basically what this is saying. So single person, married couple filing jointly. That's how that's breaking it down. Then this would be married couple filing separate, I believe. Yeah, file separate. Excuse me. I hope you enjoyed the video and you got something out of it. That's pretty much it for today on some of these changes coming into 2023. If you had any questions, leave a comment down below. And thanks for tuning in. Make sure you subscribe to the channel and turn your bell notifications so that you're always notified whenever I'm posting a new video or content. Thank you.